Hello, and thank you for joining me for today's episode of Big Ideas in Eating Disorders. In this series, we hear from people in the field of eating disorders who share with us their personal and professional journeys, experiences they've had, reflections and ideas that never quite get represented in this way in standard academic publications or professional meetings. I'm Kathy Pike, clinical psychologist and professor of psychology at Columbia University, and I'm your host of Big Ideas in Eating Disorders. I'm working with and collaborating with clinicians and professional organizations, research teams to develop this series. And our goal is really to capture the narrative history of eating disorders with the hope that our conversations will bring insights and guidance that will inspire new and next generations of leaders in the field. Today, I'm talking with Donna Friedman. Welcome, Donna.
Thank you, Kathy. It's great to be here.
Donna is founder of the Friedman Center for Eating Disorders at the Medical University of South Carolina and is someone with her own personal history of living with an eating disorder. She is an internationally recognized mental health advocate who particularly focuses on eating disorders and has served on advisory boards for One Mind and the Columbia WHO Collaborating Center for Global Mental Health. Along this journey, Donna decided to pursue a counseling degree and has her own clinical practice in Charleston, South Carolina. Donna is the first person in the history of the Academy for Eating Disorders to serve as the patient care representative. We're going to want to hear more about that, Donna, as we go. So today, let's get started sort of at the beginning, Donna, with a warm welcome. And if you could share with us what your early experience was in your introduction to what an eating disorder is.
Thank you so much, Kathy, and I'm honored to be here and to be participating in what I think is going to be a really informational and helpful podcast for many. So I was diagnosed in 1983, just after my sophomore year of college, and with anorexia nervosa. And it was very severe. And at the time, there wasn't a lot of research about eating disorders. And the first celebrity, Karen Carpenter, had just died. And that kind of brought some focus to it. But the method of treatment at that point was hospitalization long-term. No eating disorder program, at least in the Southeast, other than Duke University. So I went into a general psych unit and lived a year in a locked treatment facility with general mental health population. And I had this very wise psychiatrist, Dr. Kenneth Rockwell, and he would take 6 of us. And when I say of us, he would take 6 patients. And because we were so high intensity and we required so much observation around the table, and just, we were pretty intensively supervised. So anyway, so I did that. I did the journey at Duke for a year, and then was discharged probably about 7 months in, and then had a significant relapse and went back, and that completed the year. After that, I decided that I was going to work and do intensive outpatient. And then finally, I got to a point where I was going to go back to school and finish my degree, which had been on the table since I had gone into treatment. My care at Duke was very punitive. There was no dietary direction, instruction. It was, if you had to eat 3,000 calories, you ate it all in chocolate cake, that was okay. Mm-hmm. And so I was a pleaser, part of, we know in these eating disorders, the kind of lack of voice. And anyway, I did everything they told me to do, but I'd get out and fall right back on my face. So I went in and out of different programs. And
just one sec, when you were on the Duke unit, just trying to visualize it. Was there anyone else who had an eating disorder, or were you there on your own?
There were 6 of us. So he
So
would
when you said the 7 of us, you meant the 7 individuals who had an eating disorder who
yes,
were on the general unit.
psych unit. So we had a table in the day room,
Got
and
it.
we would come in, and the TV was there, and we'd eat, and there'd be a nurse at both ends, and then there would be another table with other psych patients.
Mhm.
And then, we had to stay an hour after our meal. We were woken at 6 a.m. to get weighed.
Mhm.
And it was at that time all girls. And so, but we were with shock treatment patients and some OCD extreme. I mean, it was a very, very traumatic experience. Honestly, I was relieved to be there, but I kept thinking I was crazy. And my parents would come weekly to visit, but it was very different then. They would come to get a report card on me. And Donna did this right, she did that right. She had to sit in the day room. So it was not family therapy, because the rest of my family was not involved in the least. I relapsed, and then finally my doctor said that at Duke said I needed to be institutionalized at the North Carolina State Hospital for 3 years, because there just wasn't any more that he felt like he could do. And my dad was like, absolutely not. And so he was a traveling salesman, and he had a colleague whose wife had been bulimic, and said, there's this woman in Cleveland, Ohio, and she has a different approach. And, my wife has done really well with her. So at 21, my parents put me on a plane maybe I was 22, but on a plane to Cleveland, Ohio. And this hippie chick with long hair picks me up at the airport with her husband and literally takes me out in the country to her house by myself, and proceeds to tell me we're going to eat from the earth. And she takes me off all my meds. Then she stripped me down into my underwear and took pictures of me. Now, if we think about that in 2023, it's pretty shocking. But she wanted me to see how skinny I was. And after leaving there for 2 weeks, I then went home and proceeded to call her for the next year at 6:00 every night and tell her what I had eaten and how I felt about it. I also
let's punctuate that for a moment, because the treatments that you're describing, as you describe them, I don't have the sense that you thought these providers were intentionally doing something virtue, but what they were doing, we understand today, was so far away from what is therapeutic and constructive. And it is a really serious take-home message around what happens when we don't have evidence-based treatments and we don't build the evidence, because, as you say, parents are desperate, families are desperate, and are going to try all kinds of things, including some variation of snake oil, if there's a promise that this is going to save their child's life.
Exactly. And, the other thing I uncovered in this box that had my name on it when Mom died was how much medication. I was literally at Duke. I was literally drugged. It was shocking how much medication I was taking every day. And it's just ironic that my mother kept. So the reason she had the Duke, she just had the bill, and I looked through the bill and could see over medication. And I'm sure that's, where people were. We didn't have the SSRIs then. So we had the anxiety, and obviously the anxiety was the driving force. And so they just really over medicated me.
And again, right, when we know now that these medications are not effective for treating anorexia nervosa, especially when someone is severely underweight. Maybe the Xanax helped you manage anxiety a little bit and some other symptoms, but certainly we know they're not the primary strategies for treating anorexia nervosa. But again, it speaks to how little the field knew at a time when you needed good care.
Exactly. And I think, interestingly enough, I don't remember a lot of Duke. And I think, I was talking to my therapist and saying, I just can't remember. And then when I found this discovery of how much medication I was on per day, I get why I didn't remember, I was a zombie. Yeah. So anyway, after my stint in Ohio, I went back, finished my degree, and went to Michigan following a guy, and then met my husband. But really continued to struggle. And I had treatment. I had a woman that I saw for 10 years, 3 times a week with 4 little kids. And that was a whole nother thing. I never thought I'd have children. And I was
right. These are your 4 little kids, not hers.
Yeah. Yes. My 4 little kids. Right.
Right.
And but I would drive out in snow, ice, whatever, rain, and see her. And after a stint of cancer with my husband, I watched myself relapse. And at that point, I had a 3, 5, 7, and 9-year-old. And I realized at that point, I couldn't leave. I just could not go back into a residential program at that time. And I just didn't want that to be a memory for my children that mom left and went somewhere. So I was living in Ann Arbor and decided that I had read a book that a friend had given me and thrown in a drawer. And it was a book called Gaining by Amy Lou. And I finally read it, and I was so inspired because she offered such hope in this book. And I thought, oh, I'll write her an email and see. I'm sure she won't respond. But after I finished the book, I wrote her an email, and she immediately responded. And I said, I need to get her to Ann Arbor because I knew that there was a population of students that were struggling. And so we brought her in, and in that process, I worked with the Center for Eating Disorders in Ann Arbor and met my now therapist, and watched her approach and her discussion with Amy about eating disorders. And Amy was diagnosed in the 70s. Actually, I don't know if she was ever clinically diagnosed, but she wrote the book Solitaire. And she was able to get into recovery without being hospitalized. But she was just fascinating to learn about and talk to. And anyway, through that, I met my now therapist of 18 years, Judy Banker. And what was so, I had many other therapists along the way, but I fired this therapist of 10 years and was terrified. And I said, this isn't working. I'm getting worse. And she had done some really unethical things. So I got up the nerve, and I told her I couldn't work with her anymore. And when I walked out her door, she said, I see why people burn out from treating this population, because you're watching someone go to die. So I walked out of her office after 10 years and not not directly saying I'm going to die, but she, alluded to that fact. And so I had been working on this presentation at University of Michigan, and I just called my therapist, Judy Banker, and said, I know we've been socializing. I know this is not a normal, relationship with a patient and a therapist, but would you be my therapist? And she said, yes. And
so before we move on to starting with Judy, when you went back to Michigan, to Ann Arbor, you and ultimately met your husband, you were doing well at that point?
Actually, when I met him, no, I was not doing well. And that prompted, actually, it's interesting, Amy Dennis Baker, he went to see her. And so I had the relapse in the early 90s, just after we were married. And that's where they actually said, I hadn't had a period in 15 years. And they actually said, you can have children. You just need to get your weight back. And so Amy used to say in her book, which I think is very relevant, I lived in the half life. Like, I weighed just enough to have my babies. And I was still struggling. I was still very entrenched in behaviors. And
so sort of like people talk about the experience of the journey of recovery from alcohol, and we'll talk about a dry drunk, right? Somebody who's not drinking anymore, but not really in recovery. Is that what you're describing here? You were just over the edge enough to have these children that you wanted to have and desperately wanted to build this family, but not in a place where you were really living in recovery, a full recovery where you're flourishing.
Yes.
So then you're vulnerable and you relapse.
Yes. And my kids would probably be very, very honest about it, but it would be Christmas morning and I would be out running for hours, and they'd be sitting there in their little matching pajamas waiting for mom to come home so Santa could be there. It was just, it had gotten really out of hand. And then that's how I got into treatment with Judy and started what I feel like was really the beginning of real recovery. When people ask me, I say, I think that would be when I got into real recovery. And, as we know with the neuroscience, which I think the researchers are alluding to, and the ones that you're talking to, as well as the ones I've talked to, is that we're finding this is a neuroscience, there's a huge neuroscience component. So I always say I'm not recovered. I would never say I was recovered. I work with this every day, but my quality of life is up here as opposed to down here. And that's kind of how I look at it.
Tell me about this idea of that from your lived experience perspective. You say, there's got to be some neuroscience here. What makes you say that?
Well, and it's funny, I asked Walt Kay like 2 or 3 months ago. I'm like, okay, Walt, I've gone through every bit of my family dynamic. I've done 40 years of therapy. And
Right.
Why am I still terrified to eat a steak, or I'm terrified to eat X, Y, or Z, or I'm terrified not to exercise, and he said that they're really finding that the reason it lingers is because it is in the neuro pathway. And so I my hope is we get that figured out. But yeah, and I think that it's a wiring. And as I look back on as being a child, we had a lady that stayed with us, and she would read me bedtime stories, and she'd fall asleep and I'd be running around. So, I think I came into this world with anxiety, but it was just never discussed or talked about. And then I have my family history of addiction. My uncle died of alcoholism. My father, I think, had some drinking issues. I think my grandmother on my mom's side was anorexic. So, I see the genetic piece as well as a part of this. I have there's 5 of us. Why was I the one that had the eating disorder? So I question that, but I think there's kind of a trifecta in the culmination of an eating disorder. And
the trifecta being
situational, genetic, and neuroscience. As my son was diagnosed at 14 with anorexia. And so if you weren't looking at the genetic piece, there you had it, and I was praying for the strong, confident daughter. I got that. And then all of a sudden my son is struggling, which, as we know, the population of males is far less diagnosed than females. Right.
So you've described so far a journey. Really, thank you for sharing your personal journey. And I have to say, Donna, for me as a clinician, it's remarkable to me your capacity to recount your experience and the generosity with which you recognize that the treatment you got was not right, was in some cases outright wrong, and whether it was wrong because it was not evidence-based or unethical or what we would consider today completely re-traumatizing. But as you tell the story, you have a capacity to observe that it was, as much as you were desperate, the providers were desperate to give you something, to provide some care.
Right.
But, it's sort of not good enough as a field. It's just not good enough. We certainly can't. And things have improved, right? But we have a long way to go. You describe clinicians, you describe your parents coming, you describe being one of 5 kids. There are a lot of people in this story. And you describe your own temperament, essentially, and maybe coming into this world with a certain temperament that predisposed you to being anxious, a genetic risk that's about generations of people in your family. As you consider all of these experiences with these people in your family, how does that get you to your evolving understanding of eating disorders and the big idea that you want to share with us today?
So that's a really good question. And I want to just go back on one of the things you said. I don't believe that I would be here today had I not had those various treatments, because in the very beginning, I was dying. I was 68 pounds. I was, so Duke saved my life in that capacity. And then, so I feel like there were nuggets of each of these experiences, whether good, bad, or otherwise, that did bring me to the place where I am today. Mm-hmm. And so as opposed to being angry or resentful, I just think we were all doing the best we could do, providers and my parents, myself. I was desperate to get better. I just didn't know how. So, I've been in private practice now for 5 years, and just the work we've done together, Kathy, and the work with the Academy. You asked me to think about one idea, and I'm like, gosh, how am I going to narrow that down to one? There's many ideas I have around this, but the word connection really resonated with me. And it started with one of my patients saying she liked, I was wearing actually this exact outfit. It's like a nice sweatsuit with tennis shoes. And I said, oh, she goes, you look so cute. I go, cute? No, I don't. I mean, I said, I and she goes, no, that's what I love about you. You come into the office and you're just you, and you don't come in like all dressed up. Sometimes, I dress up, but not, she goes, it's like this warm, it's just approachable. And so that thought started me thinking on connection. Okay, she connects because I'm not my psychiatrist from 1983 who had horn-rimmed glasses, who said very little, and he was, tweed coat. So, I mean, the quintessential psychiatrist.
Right.
And my environment is very warm. And so then I just started thinking, okay, connection. And then it really hit me that my key to real recovery was my connection with my therapist. And why was that? It was because for the first time in my life, someone listened to me about recovery. And basically, instead of telling me that I had to do this, that, and the other thing, she looked at me and said, I'm not here to tell you what to do. I'm here to guide you. I'm here to suggest things. And the first one was, I said, the scale is a trigger. She goes, okay, let's get rid of the scale. And I'm like, what? I'd been weighed and had such a calculated weigh-in with my nutritionist that just was crazy making in and of itself. I would eat the same thing. I'd wear the same clothes to get weighed. I mean, it was consuming me. And she said, Donna, I will know by looking at you and your body if we're in trouble. So out with the scale. And we just started to piece together what I thought of recovery, who I was. And so again, I go back to that connection. And for so long, my connection had been to the eating disorder, and to that I connected to the eating disorder in a way that was actually incredible and good. And that was my friend. So I was connecting with something because I was feeling so less than, and I felt worthless. So, me and the eating disorder, we had a great relationship, but I could not get better without disconnecting from the persona of me with my eating disorder. And I see that with my patients. It's like they're terrified of giving up the eating disorder because what do they have? It's like all the armor is taken off. So ultimately, as they go through recovery, I want them to be able to connect with themselves, because I think at the end of the day, you have to connect with yourself and do this, yes, with help, medications, whatever types of therapy, but you ultimately have to separate yourself from your eating disorder. And I think that gives me a lot of experience, but a lot of wisdom to give to my clients, because, I don't tell them I don't have distorted eating thoughts. I'm very honest. I tell them I still struggle from time to time. And, it has really resonated a lot with them, because I think it's such a complicated illness. And it's, as we talk about the way of treatment and the way, we're going to get better care for folks, it's like, this is complicated. And the people that I work with that are addiction specialists, they won't touch this. They won't touch eating disorders. I'm like, okay, wait, you work with alcoholics and drug addicts because you have to make peace with your poison. So, so connecting with someone that understands what that's like and how challenging it was for me, but they see hope.
So this big idea around connection, like many big ideas, it's profoundly simple and profoundly layered and complex, right? In talking about connection, you've mentioned connecting to the eating disorder, connecting to yourself, connecting to your therapist, connections that were constructive and therapeutic, connections that weren't. And that's a lot, right? And how do you, when you think about connection, and you knew when the connection was right? You talk about getting to a point with this therapist who you'd been seeing for many, many years and thinking this connection isn't quite right, or isn't right at all. Maybe it was at one time, but certainly not now. How did you know? How did you know that this was a connection that you had to step away from?
I don't know. I think it was just this gut feeling. And I actually did a talk on this through AEG several years ago about breaking up with your therapist. I mean, it would.
So tell me about that, because you also mentioned that you are someone who has a tendency to please. And here you have this therapist who is kind of shaking her head and, in not such a veiled way, expressing disapproval that you're leaving. And it's hard. It's really hard to trust yourself at moments like that. So tell me about breaking up with your therapist, and how does the story of connection fit in there?
Well, so obviously, treatment, me going into residential treatment was, a big word. And the interesting thing is my husband would call her and I would walk into session and she'd say, well, your husband called and he said this. And so it's like I'd walk in and I'd be in trouble. Like I felt in trouble. And I started lying to her because I wasn't doing what she was recommending. So it became just like this hour of just, I really didn't trust her. After she talked to my husband behind my back several times, I lost trust. And then I felt really insecure because I felt like, she had broken the trust between myself and her. And it was like I felt ganged up upon. And I think that was it. I think that the threat of residential, but more importantly, how I felt I had so disconnected with her because of I was lying. I wasn't connecting. I was lying. I would lie to her about what I was eating. I'd lie to her about everything. And so that started to feel terrible. Like I'm lying to please her. And why? And I'm getting sicker because, I'm not in treatment per se.
That's really profound. You're not in treatment. You're not connecting, right? I mean, what you said is so simple, but it's so true. You're in the room, but if you're lying to her and you don't trust her, then you're not really connecting. And there's a moment, it sounds like, where it
Click.
came together in a way, it clicked, where you said, we're not connected. We're not together on this, and it's not helping me.
We talk about this a lot in therapy about assertiveness and, using voice, because that's also a huge piece in my recovery was that I don't feel like I was ever able to use my voice in many decisions and a lot of different decisions in my life, and how, it's terrifying and to use your voice. And a lot of my clients, I'm like, you can be assertive without losing that person. And, I think probably I would have done this sooner had I not been afraid of the outcome. Like she'd be mad at me.
Donna, you said the first treatment was 1983 at Duke. So in the early 1980s, actually through the 1980s, probably into the 1990s, as I reflect back, within the eating disorders community, there was a unwritten practice that somebody who had an eating disorder couldn't be part of the care team. Tell me about your experience as the first person in the history of the Academy for Eating Disorders to hold this role as patient care representative. What were the challenges, and how do you think the field is evolving in terms of understanding the role of people with lived experience?
It's funny because I think at the point in my journey that I did that role, I feel like, I had not started my practice. I felt very, and I've said this to you, Kathy, because ever since we met that many years ago, you've always treated me as an equal. And I didn't feel I got that treatment. I felt like I wasn't treated. I still felt that I was the sick one in the room. And it's not like anybody was like said anything. It was just the vibe that, I wish I had been more secure in myself, because I think I'm so much further now in my recovery. I think I could have I would feel differently just because I've gained confidence in what I know. But it was hard. It was hard. I didn't have PhD at that point. I didn't even have MS after, I hadn't had my master's. So I felt underqualified. But Dr. Nichols, I probably don't want to name names, but there were people on that board that embraced me. But now I think we have 2 or 3 on the board. So I was the guinea pig, and it's
2 or 3 patient care representatives.
I think there's more than one now. I don't know what the board structure looks like exactly, but I took it for the team, and I'm glad I did, because I think it was very, very important, but it wasn't easy.
I'm sure. So Donna, as you describe your journey, I am really in awe of your courage. Actually, you say you took it for, took one for the team, but you leaned into this recovery over and over again. And you also several times, as we've been talking, mentioned this idea of hope, right? That there was a clinician shaking her head, that you were walking yourself out the door and potentially on a course towards the end of your life. You mentioned a clinician who communicated to you, Amy Lou, whose life experience communicated to you the idea that there's hope. Mm-hmm. And you leaned into this role as patient care representative, thinking this might not be easy, but it makes for a better future. Tell me about how you think of that in your course of recovery, and maybe in this story of connection.
I didn't always feel hopeful. I was pissed half the time because I was miserable, but I don't think you can ever lose hope. And I think that also brings connection, because I don't look at this as a death sentence. I know it has a high mortality rate, and I have some very, very sick patients right now that may not survive. But the message that you can live life with this, just like you do diabetes, you have to check your sugar. I think that's the connection I want everybody to see. And I want them to see that, yeah, my life has had challenges, but every step of the way, the connection, whether it was a bad connection or it was a good connection, it got me to where I am now, where I feel that I'm finally at a place where I can say, I'm good. I'm good at what I do. I love what I do. And I think that's another piece of it, that I'm passionate about it. And I think, some therapists aren't, and a lot of them don't want to take this on because it's complicated and it's sad, because it's not all done end well. But I never lose hope.
Yeah, lose hope, game over.
Right, lose hope, game over.
So, Donna, we've been on a journey. You've been on a journey, and we are so fortunate that you are here connecting with us to share your story, because there's so many lessons learned and so much wisdom that you've shared. Your recounting of your own personal journey, who you trusted, who violated your trust, your willingness to continue to trust the carers in your life, even when people didn't know really what, I don't want to say they didn't know what they were doing, but the knowledge around treatment was so rudimentary and in some moments wrongheaded. And your perseverance on this journey to connect to yourself, to find your own voice as you connected to people who could therapeutically care, is really an inspiration.
Oh, thank you, Kathy.
So, thank you for sharing with us not only your starting point, but your journey and your wisdom at this point, both in your lived experience and as a clinician, and all that you've contributed to the field in helping us really bring carers and people with lived experience into this complex story as we try to better understand and not only treat, but prevent these disorders from eclipsing people's lives. So thank you so much, Donna.
Absolutely happy to do it, Kathy. Thank you.